everyone. I'm Natalie Shurtleff. I'm the Associate State Director of Advocacy and Outreach with AARP Connecticut. Welcome to another episode of Coffee and Tea with AARP Connecticut, our biweekly interview series about the issues important to people 50 plus here in Connecticut. So today, our guest is Tanya Barrett, Senior Vice President of 211 Health and Human Services with United Way of Connecticut. So today, Tanya is going to tell us a little bit about how 211 and AARP are working together. But first, Tanya, why don't you start by telling us a little bit about United Way of Connecticut's mission and how 211 fits in?
Yeah, sure. I'd love to. So our mission is to help the residents of Connecticut to thrive through trusted partners and innovative solutions. And the main way that we do that is through our partnerships with the state of Connecticut. We're able to resolve housing crisis, connect residents with critical food resources, help people access mental health resources, troubleshoot child development concerns, and secure childcare as some of the top line things that we do. It's important to know that 211 contact specialists are compassionate human service professionals who are on the other end of the line trying to save a life or help improve someone's life. We're not a patch-through service, so it's not just you call and we give you a resource. There is a lot more dialogue that happens to help callers to kind of tease out the root causes of their issue and get connected to the right resources. And we do this one phone call at a time, and it can be transformative. Currently, we have about 40,000 programs and services in our database, and we have a benefit screener that offers screening for 23 state and federal benefit programs.
Wow, it's a lot of great resources for folks. So how long has 211 Connecticut been operating, and how many residents do you serve?
Yeah, so 211, we're actually celebrating our 50th anniversary on February 11th. So this coming year in 2026. And 211 Connecticut is actually the first statewide 211 across the country. And it has supported countless Connecticut residents by connecting them to essential services to help them meet basic needs. And we responded to over 1.7 million requests in FY 2025. So it's a very fast-paced environment where we're serving many, many different people in need.
Wow. Have you seen any changes in the numbers and types of calls that you receive?
Yeah, definitely. We're seeing an increase in need. We've seen a 300% increase in both 211 phone and web requests since 2019. And that number is excluding our COVID related requests. During the pandemic, we played a special role, which increased our volume tremendously, as you can imagine. Right now, what we're seeing is that due to what's happening on the federal level with SNAP benefits, a huge increase in the number of SNAP calls and food-related assistance calls. So last week, we saw an 18% increase as compared to the same week of the previous month. We're also seeing a kind of disturbing trend with senior citizens. So, particularly the ages of 60 to 74, callers who are calling us from within that age group are looking for housing resources a lot more frequently than they have in the past. So, we're seeing that number grow significantly. And just to give you an example of like a type of call that comes in, especially now around this SNAP concern with benefits, we'll get a call in. We got a call from a woman who was looking for a SNAP benefit information. She had heard that, the benefit was going to be not issued or frozen for November. She happened to mention during the call that she had exhausted her FMLA hours and that she was caring for her disabled daughter. We were able to provide her both with the information she needed to get food assistance and to help her by connecting her to the AARP caregiver resources. So that's an example of something maybe that people did not call in for, but end up disclosing to us on the call. And then we, as our trained contact specialists, are trained to be able to then suggest things that might help them in their everyday lives that they weren't even thinking of.
Great. I love that about 211. It really being able to dive deep into the root causes of a caller's um, needs. They may call in with this top line need. They need food assistance. They're struggling there, but then to be able to connect them with other resources that they may need. So you mentioned there the connection with AARP. So can you share with our viewers how 211 and AARP are working together?
Yeah, we're really excited about this partnership, Natalie. United Way of Connecticut began partnering with United Way Worldwide and the National AARP on August 8th to participate in their joint 211 caregiver program. And for those of you who don't know, 211 is actually a national system, so there are 211s all across the country. We've been working hand in hand with the Connecticut AARP to ensure that 211 Connecticut has the most up-to-date resources in the state. And you can tell from the example that I've already shared that caregivers call 211 for many different reasons. And in general, they really don't always know exactly what the need is or what resources exist when they reach out. So 211 is here to help them understand their situation, guide them to the best next step. And another example of that is, a woman who called who was currently using her FMLA benefits to care for her mother. And this person had no idea about the caregiver resources that the AARP provides and was really thankful because it was a helpful resource for her. So, with this partnership, as of the end of October, we've identified 107 caregivers and provided 426 resources, which is really exciting for us because these are resources that people would not have known about but for this program.
Great. So when caregivers call in and they get connected to those resources, get identified as a caregiver, what types of resources are you able to provide?
Yeah, so it's a range of things. Part of our job is to listen, to be supportive, to show empathy to our callers who are often dealing with many different issues all at once, and to tease back some of the root causes and issues that could be addressed through the resources that are available. So some of those resources are healthcare resources. So some folks need help getting Medicaid or understanding how they can apply for the exchange. There's questions about transportation. So we give people resources. Not everyone who calls us can actually just jump in the car and go. Some folks need help actually getting to the place to receive the resources. Case management is also a service that we will frequently refer to, and that is connecting someone with a professional that can help them navigate the different systems that either they or their loved ones might be interfacing with and trying to access services from. For mental health, we do a lot of suicide prevention. So not only are we the 211, but we actually answer the 988, which is the suicide and crisis lifeline nationally. We answer the calls for Connecticut and help by de-escalating emotional crises that people present with. Happy to say that that results in a reduction in their state of crisis over 99% of the time, which is kind of an amazing statistic when you think about if they weren't able to receive that
Yeah, that's so
resource.
important.
Yeah. Legal and advocacy services, people have questions about legal issues. As you can imagine, with the caregiver population, we're talking about some folks who are wanting to know about conservatorship or wanting to know about different rights or access that they may need to help a loved one. And then there's the caregiver financial assistance, which includes understanding our Connecticut paid leave system for caregivers, how to access that. We actually have a specialized unit that supports people with understanding what the benefit is and how employers can plug into it for their employers. And then respite and support groups. So people who are caregiving are often on 24/7 and they don't get a break. And I was recently at a conference last week and I heard a speaker talk about, that metaphor about filling your cup first. She had a different spin on it, and I really liked it because her spin was you can't just fill your cup. You fill your cup, but that doesn't mean you start pouring it. You fill it. When it overflows, you share the overflow so that you are operating at full capacity. And I thought that was a good metaphor because often we say, okay, we'll fill the cup and we'll go halfway down. But we're not giving our best. And so I think I like to describe respite like that. It's a chance to fill your cup so you can help your loved one even better and with renewed energy, grace, empathy than before. So those are some of the services, and of course, just support in general is so important for caregivers to know that they're not alone, that there are other people experiencing the same things, other people have gone through the same types of concerns that they have, and that they're often willing to share. So there's no need to repeat the wheel if there is a solution. And so our job is to let people know about those programs and get them connected.
Great. I really love that fill your cup metaphor. I mean, caregivers give of themselves so much, but it's so important that they be able to take care of themselves and get the resources, the supports that they need to fill their own cup before they're caring for others. Um, so thank you for sharing that. So, how do Connecticut residents reach out and get these resources?
Great question. So people can access 211 online at 211ct.org. We offer our resource database online, so people can search for services. They can also use our 211 navigator to screen for benefits, or they can call 211. So you just dial 211. We're available 24/7, 365 days per year. And we've created a special paper. We call them white papers, e-library papers on finding resources for caregivers. And that has comprehensive information about some of the AARP resources, as well as some of the community Connecticut-based resources that are available for caregivers. So encourage you to either go to the web or to call us to find out more about resources that might help you and your family.
Great. Well, thank you so much for joining us today. I think we've learned so much about what 211 and United Way of Connecticut do and what resources are available for people. Before we wrap up, is there anything else that you would like to share with our viewers?
No, I just, again, thank you, AARP, for this really great program. I think your partnership with 2-in-1 is really going to return dividends across the nation, especially during these times where we are experiencing a lot of food assistance needs, a lot of housing assistance needs, and people needing support. So identifying caregivers and helping them to be able to continue helping is critically important at this time. So thank you.
Great. Well, thank you again, Tanya, for joining us today. And thank you to all of our viewers for tuning in to another episode of Coffee and Tea with AARP. So join us again in 2 weeks for another episode and catch all of our back episodes on YouTube and on Facebook. And before you go, scan this QR code to become an e-advocate and help us advance policies important to the 50 plus here in Connecticut. Thank you.